Hello everyone, good to see you all in part 2 of skin infection. In this video we're going to see about ecthyma. Ecthyma is a type of superficial skin infection just like impetigo. In the early part of this infection it resembles just like non-bullous impetigo, and in the later part it will evolve into deeper chronic infection. Okay, so you can see here it starts as a vesicule or vesicular pustule just like the non-bullous impetigo, and it starts to erode into the dermis through the epidermis. And this, once it started to erode, it will cause a obscured, dry, tightly adherent crust on the top, just like you can see in this picture. What this crust do is it will not allow the skin to approximate. Once this crust is formed, the approximation is not possible, so this skin lesion will not heal. So it will predispose to infection. So the recurrent infection will lead to scar formation as well. So what are the causative agents of this ecthyma? Primarily caused by group A beta hemolytic streptococcus. And Staphylococcus aureus also can cause, but as a secondary pathogen. Okay. So you can see in this picture, there are multiple lesions in the skin. So this formation of this multiple lesion is commonly seen in ecthyma. Why? Through a phenomenon called autoinoculation. So what is autoinoculation? The infection or the inoculated bacterium from one side will spread to another side. There are predisposing factors for this autoinoculation: insect bites, scabies, periculosis, and pleurotic lesions. All these will cause a frequent scratching by these patients. So, this frequent scratching will lead to skin openings in multiple sites as well as spread of bacterium from one side to another side. So, this will cause multiple autoinoculation and multiple lesions, as you can see in this picture. So complications, yeah, it can cause complication just like impetigo, lymphangitis, cellulitis, post-streptococcal glomerulonephritis also can be caused, but PSGN is rare. Treatment option, the problem here is the crust on the top of the lesion will not allow the skin to close, so we have to remove this crust. So how to remove this crust? We can use warm compression over this crust, which will lead to softening of this crust. Once this crust is softened, we can remove this crust easily, which will lead to healing of the ulcer. And also we have to use antibiotic. Penicillin is the antibiotic choice, to which almost all the lesions will respond. We can also consider systemic antibiotic, just like in impetigo, if there is complication and systemic features are visible. So there is another phenomena called ecthyma gangrenosum. What is ecthyma gangrenosum? This is a variant of ecthyma which is caused by Pseudomonas aeruginosa in immunocompromised patients with neutropenia. So neutropenia is a risk factor for ecthyma gangrenosum. Neutropenia is found in immunocompromised patients uh, who will be infected by Pseudomonas aeruginosa, which will cause to ecthyma gangrenosum. This also can be seen in normal patients. 6% of the patients who is having systemic infection of Pseudomonas aeruginosa can develop ecthyma gangrenosum. And also by local inoculation also can lead to ecthyma gangrenosum. So these ecthyma gangrenosum will first begins like a purpuric macules. You can see in this picture, these purpuric macules will form vesicles, and then they will get ulcerate and form a lesions like you can see in this picture. So these lesions will have uh, center depressed black color crust, which will be surrounded by raised edges, as you can see in this picture. So a punched out lesion like this will be formed. So these punched out lesion can be either multiple or a single lesion. and commonly seen in the places of apocrine areas. And there's another point to be remembered. These punched out lesions will extend to dermal veins. And this will also erode the dermal veins up to adventitia and media, not the intima. So it's also good to remember these points. And these erosion will spare the arteries as well. And there is another phenomena called pyoderma gangrenosum. No need to confuse with ecthyma gangrenosum. So pyoderma gangrenosum is not infectious or not gangrenous. It is secondary or a feature of inflammatory diseases. So totally different phenomena. So the treatment option, we have to start broad spectrum antibiotic to treat this condition, including Pseudomonas coverage. So what are the antibiotic having Pseudomonas coverage? Anti-Pseudomonal penicillin, aminoglycoside, cefepime we can use for ecthyma gangrenosum. It's always better to take a skin biopsy for culture before starting the antibiotic as well. So that's all about ecthyma, and we'll meet you in another video. Thank you so much.